A revolution in hypertension management, blood pressure lowering vaccines. Controlling high blood pressure is often a lifelong commitment that requires ongoing monitoring and medication adherence. According to the World Health Organization, more than 1.28 billion adults worldwide have high blood pressure, with only 1 in 5 having the condition under control. For patients with diabetes, the need to properly control blood pressure is even more important. The consequences of uncontrolled high blood pressure are serious, including heart disease, stroke, and chronic kidney disease. People with diabetes are particularly vulnerable because they often face the dual challenge of managing blood sugar and blood pressure. Unfortunately, medication adherence can be inconsistent, especially for people taking multiple prescriptions at the same time. Many patients either forget to take their medications or take too much, causing blood pressure to fluctuate with dangerous and sometimes life-threatening effects. This is what the blood pressure vaccine is meant to solve. The blood pressure-lowering vaccine being developed in Japan uses a new approach that uses the body's immune system to maintain stable blood pressure levels. The vaccine focuses on angiotensin II, a peptide hormone that plays a central role in blood pressure regulation by tightening blood vessels. By reducing the effects of angiotensin II, the vaccine may help keep blood pressure within a healthy range over the long term. This is a significant shift from current approaches to treating high blood pressure, which typically involve drugs that block the production of angiotensin II or prevent it from binding to its receptors. These drugs, including ACE inhibitors and ARBs, while effective, require daily dosing, which can be difficult for patients to maintain long-term. Additionally, some patients experience side effects from these medications, such as cough, fatigue, or increased potassium levels, which may further hinder compliance. The vaccine offers a promising alternative by inducing the production of antibodies that neutralize angiotensin II. These antibodies work by binding to hormones and preventing them from interacting with receptors on blood vessels. As a result, blood vessels remain relaxed and blood pressure remains at a lower, more stable level. The idea is that with just 2 injections per year, patients can maintain stable blood pressure without having to take daily medication or worry about the blood pressure fluctuations that often occur with oral treatments. This approach also has the potential to reduce the incidence of side effects associated with traditional blood pressure medications. Because the vaccine targets only angiotensin II, its effects may be more selective, leading to fewer adverse effects. While the potential benefits of blood pressure-lowering vaccines are clear, significant challenges need to be addressed before they can become a widely used treatment. One of the key challenges is ensuring that the vaccine provides consistent and long-lasting protection against hypertension without causing harmful side effects. Because a vaccine stimulates the immune system to produce antibodies, there is always the possibility that it could trigger an immune response that could lead to inflammation or other complications. In addition, researchers must determine how the vaccine interacts with other medications patients may take, especially diabetes medications. Another challenge is determining the optimal dose and frequency of the vaccine. While the goal is to lower blood pressure with just 2 injections per year, some patients may need more frequent doses, especially if their immune response to the vaccine weakens over time. Long-term studies are needed to assess the durability of the vaccine's effects and to identify any potential risks associated with its use.